In this podcast episode, Dr. Nick Norwitz, a PhD in metabolism from Oxford University and a medical student at Harvard, discusses the intricate relationship between diet, heart disease, and inflammation. The conversation delves into various dietary patterns, the impact of specific nutrients, and the emerging research that challenges conventional wisdom regarding heart health. The podcast opens with a startling statistic. Every 40 seconds, someone in America suffers a heart attack. Dr. Norwitz attributes this alarming trend to several factors, with a significant emphasis on diet. He explains that many diets are laden with saturated fats, which can lead to clogged arteries and ultimately heart attacks. However, he suggests that the narrative surrounding heart disease is more complex than simply blaming saturated fat. Dr. Norwitz introduces a groundbreaking study focusing on a unique group of individuals known as lean mass hyperresponders. These individuals adopt low-carb diets and experience dramatically elevated levels of LDL cholesterol, sometimes reaching levels as high as 600 milligrams per deciliter. Contrary to conventional wisdom, this study found that most of these individuals did not experience plaque progression in their arteries, challenging the long-held belief that high LDL levels are inherently dangerous. The study utilized advanced imaging techniques to assess both calcified and non-calcified plaques over a year. Surprisingly, the results indicated minimal plaque progression in the majority of participants, regardless of their high LDL levels. Dr. Norwitz emphasizes that the primary predictor of plaque progression was not LDL cholesterol or ApoB levels, but rather the presence of plaque at baseline. This finding suggests that the context of an individual's overall health and metabolic status is crucial in assessing heart disease risk. The discussion shifts to dietary recommendations, with Dr. Norwitz addressing common questions about the best diet for heart health. He emphasizes that while a low-carb ketogenic diet may work for some, it is essential to consider individual responses. He notes that a low-carb diet can lead to significant improvements in inflammatory markers and overall well-being for many people, particularly those with metabolic issues. Dr. Norwitz also highlights the importance of understanding the nuances of dietary fats. He argues that not all fats are created equal, and that the quality of fats consumed matters significantly. For instance, while saturated fats have been demonized, he points out that the context in which they are consumed, alongside other nutrients, can influence their effects on health. A significant portion of the conversation revolves around the debate on fiber and plant-based diets. Dr. Norwitz acknowledges that while fiber is often touted as essential for gut health, it may not be suitable for everyone, particularly those with specific gastrointestinal conditions. He shares his personal experience of having ulcerative colitis, which led him to explore various dietary approaches, including ketogenic and carnivore diets. He argues that the blanket recommendation for high fiber intake may not apply universally, especially for individuals with compromised gut health. Instead, he advocates for a more personalized approach to diet, where individuals assess their own responses to different foods and adjust accordingly. The podcast also touches on the emerging concern of microplastics and their potential impact on health. Dr. Norwitz discusses a study that found microplastics present in the plaque of individuals with heart disease, raising questions about the environmental factors contributing to cardiovascular issues. He emphasizes the need for further research in this area, as the implications of microplastic exposure on human health are still not fully understood. Another hot topic discussed is the use of artificial sweeteners, particularly aspartame, and their association with heart disease. Dr. Norwitz references a recent study that suggests aspartame may contribute to heart disease progression through mechanisms involving insulin resistance and inflammation. He clarifies that while the study was conducted on animal models, it raises important questions about the long-term effects of artificial sweeteners on human health. Dr. Norwitz encourages listeners to consider the potential risks and benefits of consuming diet sodas and other products containing artificial sweeteners. He emphasizes that while these products may help some individuals reduce caloric intake, the emerging research warrants caution and further investigation. Throughout the podcast, Dr. Norwitz advocates for a more nuanced understanding of diet and health. He encourages listeners to question conventional wisdom and consider their unique circumstances when making dietary choices. The conversation highlights the importance of individualized approaches to health, particularly as people age and face different metabolic challenges. In closing, Dr. Norwitz emphasizes that while there are no one-size-fits-all solutions, being informed and open to exploring various dietary strategies can empower individuals to take control of their health.